right, guys, I am noticing and I'm getting reports from clinical faculty and dentists that we're having some generalized issues with getting open contacts. I'm guessing, based off of what I'm seeing as I grade full mouths, that it is primarily a premolar problem. And we talk about this during H305 when you learn how to take x-rays, but it's just a concept that clicks sooner than later for others. And as long as we get it to click by the time you guys are graduating and out in private practice, that's really all that matters. But let's see if we can get it to click like right now. So when you're taking, let's pretend this is my PID. And that's, we have a cotton swab taped on the opening of the PID to show us our horizontal angulation. This is all going to, a lot of it's going to be review, but just hang in there with me and please watch the whole thing anyway. If I'm shooting for molars, you would want to place a cotton swab or an imaginary one, but you can do this actually in people's mouths if you're struggling with horizontal angulation against the buccal surfaces of the molars. Don't just stick it in there all willy-nilly. Make sure that it's actually touching the teeth you're focusing on. And then if you were to have a cotton swab taped to your PID, or if you actually place one up against it, that's fine. There's no shame in it. I'd rather you do that than have to do retakes. The two sticks should be parallel. And I want to make sure you guys understand that parallel means that if these two sticks were a mile long, they would never cross paths on either end. So the distance between the sticks back here is the exact same as the distance between the two sticks towards the anterior section. So even though this is a pretty minor difference in parallelism, this is enough to cause some close contacts. This stick here is representing my beam, which needs to be perpendicular to the teeth you're aiming between, so that it's kind of like an arrow going between the tooth. So right now, it's like an arrow going between the two molars, so that contact would be open. It's really not hitting enamel, it's hitting the airspace in a proximal. And that's because my cup, my PID opening, is running parallel to the buccal surfaces of those two teeth. If I make this slightly unparallel, this might seem like, oh, it's good enough. It's pretty close to being parallel, but the beam is going to be nicking, going through this cusp and going through this cusp just a little bit. So these two cusps are going to overlap each other a tiny bit on your x-ray. And then another trick with bite wings, especially with molars, is if you're in a pinch, this isn't the most accurate thing to do, but if your patient has normal anatomy, it would be like your beam is coming out of the ear canal on the opposite side. So their patient's ear would be right here if this was a real person, and it would seem like your beam is shooting out the ear. And it also works for the premolars, because as they come around and I'm shooting between the two premolars, if you'll notice, I'm still aiming out the opposite ear. So if you're in a pinch, you only have 2 seconds to get things lined up. As long as your patient has pretty normal anatomy, you can use that trick. And as you would see, if I run my Q-tip over these two premolars, I moved it on accident there. My two sticks are parallel. Even if they were a mile long, they'd never cross paths, which means my beam is going like an arrow in between the two teeth. When you're taking periapicals, if a patient, especially on the maxillary, even if they've had ortho, second molars tend to be slightly buccal-verted rather than being in perfect alignment. So it is not uncommon for first and second molars or second and third molars to have some overlapping, even if you use the textbook correct horizontal angulation. So that's natural overlap, as you know. If a dentist ever tells you that they specifically want that contact open, you're going to need to, when your patient is open, look at the two teeth, see if the crookedness is causing the contact to run this way or this way, and then mimic that with your beam. So you will look at the crevice between the distal of this tooth and the mesial of this tooth. This model has like a prepped crown tooth, so there's not actually a contact here, so it's not the best example to set. Let me see if I can find a better one. You can actually see the angle the contact runs at by looking at the space in between the mesial marginal ridge of this tooth and the distal marginal ridge of this tooth. So this contact is actually kind of running at an angle. So if you want this specific contact to be open, you would have to match that angle with your beam by angling it slightly more distal than what the textbook angulation would have you do. So if you have a natural overlap and the dentist asks you to get that tooth open, you're going to have to just look in the patient's mouth. If it's natural overlap, you know it means a tooth is crooked. So you're going to have to look at the occlusal tables, identify the angle that that interproximal looks like a crack between the two teeth. What's it running at? Mimic it with your beam, shoot it like an arrow through that crack, and you'll get that open. The others will be closed, but if your dentist wants this one open, that's how you make it happen. Now going back to the whole thing with premolars, what happens a lot, and I'm going to use a SuperBite without a film in it because these Typodonts, they don't really have enough room for a film to also be in here. This bar here runs parallel with your film holder, so it's parallel with your film. And if I had the ring attached, it would also be parallel. So ring, bar, film are all parallel with one another due to the way that this gadget is designed. This bar here is like a very short cotton swab, essentially. So as you place it in your patient's mouth, if this bar is running parallel to the cusp tips of the premolars, then the ring will give you an adequate or an accurate horizontal angulation to get those two contacts open. Because this bar is just a smaller version of doing this against those two teeth. So as you're placing it, try to place it as you're going in with the film holder to begin with, try to place it initially at an angle where this bar is going to be parallel with the cusp tips of the teeth that you're aiming between. Then you know your ring is accurate and you will get an open contact if you placed it that way. And as you'll notice, it's equidistant. So this border of the film is about the same distance away from the teeth as this border of the film is. Unfortunately, this isn't necessarily what happens in real life. In real life, patients have tongues on the mandible, and they don't like their tongue being pushed over like this, so their tongue does this. And now this bar is running parallel with like the canine and lateral, canine and first premolar. So these contacts would be open, because your beam would be an arrow going between that tooth. But as you go further distal in the mouth, the contacts will get more and more overlapped. And I'm seeing this a lot. Sometimes I can even see the lateral in your premolar exposures. The lateral will be open with the canine, and then we get more overlapped the further we go back. That tells me your angulation was correct for an anterior because your film holder was angled severely across the mouth like this. So either that's because the patient didn't like their tongue being shoved over, so they did this to it. And sometimes you can fix it and put it back where you want it and say, I'm sorry, I need this to be pushing against your tongue. Please bite and hold it here for me. If they keep doing this anyway, some patients literally just can't physically control their tongue, then sometimes it's not possible to correct it. The other thing that causes this to happen is you guys get so concerned about making sure the distal of this canine shows up on your film that instead of placing it properly for a premolar, you exaggerate it this way and you get a lateral, sometimes even a central, you guys. You get a lateral, a canine, both the premolars and just a little bit of the molar. What we want is the distal half of the canine, both premolars, the whole first molar, and you'll usually get most of the second molar in there because premolars are tiny, so there's plenty of room for their friends to join the party. Now, if you do this in itself wouldn't necessarily be the end of the world, other than the fact that it's going to throw off your horizontal angulation because you're parallel with anteriors more than you are with the premolars. But if you're stuck with this placement, either because that's what you have to do to get the distal of the canine, or because your patient is being stubborn and keeps shoving it over with their tongue on the backside, you can, if you can't fix it and make this bar parallel with the two teeth you're aiming between, then you have to ignore the ring because the ring will be lying to you. And the reason why it happens so often on the premolar shot is because the patient does this or you do this to make sure the canine is in there. So if this is where you're stuck with your placement, you're going to either have to use your imagination to realize that this is the proper angle for your horizontal angulation, not this. You can fudge it. Hang on, let me grab the ring. All right. If you are good at visualizing, let me do this properly. There we go. You can ignore the ring You still kind of use it to help make sure you don't cone cut, and you can still use it to help make sure you have the correct vertical placement. But in terms of horizontal, you would look like this. So again, my cone, the ring is helping me not cone cut. I can kind of gauge where the film is hiding inside the mouth based on where the ring is. And it'll show me my vertical, that will be accurate, but it's the horizontal that's not accurate. So you can either ignore the ring and place your cone like this. The good news is the ring will not show up in your x-ray. So even though your placement is not correct, your angulation can still be correct and you'll still get your contacts open. Or you can take the ring off and just use this as a plain old film holder rather than a position indicating device, and line it up according to the correct angulation of these two cusp tips. And if you have to, go get a clean cotton swab, even if it's a human patient, not just Dexter. Don't hesitate to use cotton swabs if you're struggling with horizontal angulation, because that's better than doing unnecessary retakes. If you remember, lots and lots of retakes, what would be considered an excessive amount of retakes is considered malpractice. So if this is a generalized problem you're having, go back to using cotton swabs in your patient's mouth if you have to. Just make sure that you're bridging them across the teeth you're actually focusing on. A lot of times I'll see students doing a premolar bite wing and they're just sticking the cotton swab in there like this, in the cheek. Well, this is against the molars, so that's showing you molar angulation. This is showing you premolar angulation. This is showing you canine angulation because you're aiming for the mesial of the canine. This would be for centrals, so that you're shooting your arrow between the centrals. And then as you go around, just make sure that you're aiming, if you're using the cotton swab, you have to be touching the teeth that you're trying to get open. Make sure you're not touching other teeth. But if you can get the hang of using this bar here as a tiny version of that cotton swab, it's going to be faster. It's going to be more accurate probably, easier, less intrusive, fewer things hanging out in your patient's mouth. Just use this if you can. All right. But again, just because you place it like this doesn't mean this is correct. However you place the film in the patient's mouth, if you're using a beam alignment device, your beam alignment will be 100% dependent upon where you place the film inside the mouth. If you're using a beam alignment device, you have to place the film perfectly, otherwise the ring is lying to you. So either fix this so that it's perfectly parallel, equidistant from the teeth you're shooting between, or know that the ring is lying to you and ignore it. So this way the ring is lying to me if I'm trying to get the premolars, so I'd have to ignore it and either use cotton swabs or make a mental image of where the cotton swab would be and line this up so that it would be shooting between the two premolars. All right, if you still have questions, please let me know and I will try to find another way of explaining it to you, or I'll work with you one-on-one with Dexter sometime. But open contacts is really something you guys all need to nail by the time you graduate.